work on today?
Just gonna do the bike for 30 minutes.
Oh, nice. And you have a game coming up this weekend?
Yes.
All right, I'm gonna go grab you some water, okay?
A few moments later.
Are you okay? What's going on? Can you breathe? Okay, slower breaths. No more? Okay, let's go to urgent care. Grab your backpack.
Oh, hi. Welcome to the urgent care.
Hi, my sister here is having trouble breathing.
Okay. May I have your name and date of birth, please?
It's Amaya Lopez. Lopez.
Okay. And what brings you in today?
Her breathing is a little. She's hyperventilating.
Okay. May I have an ID, please?
Yes.
Okay. Thank you. And do you have an insurance with you?
Yes.
Okay. I'm gonna have you fill out these papers, please.
Okay.
I'll be with you in a little bit.
Okay.
One eternity later.
Hi, Lopez. The nurse is ready for you.
Hello, my name is Crystal. I'm a nurse. I heard that you're having some trouble breathing. Is that true? Okay, could I please have you sit up to see if this will help you at all? Okay, thank you. And I'm going to check your oxygen levels, okay? Put your hand down, okay? Has she ever had any trouble with breathing, like any problems
No.
breathing or asthma?
Not really, just here and there, but we did use an inhaler with albuterol, but it just doesn't help.
How long ago was that?
3 days ago?
Okay, and it didn't help her?
Correct.
Okay. Okay, so then I'm gonna check what the reading is. Okay, you're at 89, so your oxygen level is pretty low. I'm going to put you on some oxygen, okay? I'm going to be doing the interview, and I'm also going to be checking your vitals today. I know that you are having trouble breathing, so is it okay if I ask her the questions that I would ask you? Okay, perfect. Could I please have you give me her full name and her date of birth, please?
It's Amaya Lopez,
Mm-hmm.
5'9", 2000.
Okay. What is her occupation?
She's a student.
Okay. What is the highest level of education?
She's in school right now, junior.
Okay. An emergency contact in case of...
Me, her sister,
Okay, your name, please?
Jennifer.
Okay, and your phone number. What is her ethnicity?
She's Hispanic,
Okay, and when she was born, was she born as a female or male?
female,
Okay, and what gender does she identify herself with?
female.
Perfect. Okay, so what is the reason for coming in?
So she was having trouble breathing while she was exercising.
Okay, how long was she exercising for?
About 30 minutes.
Okay, and was she outside, inside?
Inside a gym.
Okay, and how long was she into the workout before this started happening?
Probably 10 minutes or so.
Okay, let me see. Does she have any pain in her chest area? You do? Okay, let's see. Does anything, if anything at all, make it worse or make it better?
I think no. Well,
No?
working out
Nothing
caused
makes it better. Okay, is the pain sharp? Is it like throbbing, stabbing, shooting? Is it dull?
Sharp.
Sharp. Okay, perfect. Let me see. And is it just in one place? Where? Can you show me where it's at? Okay. Does it stay there? Or does it move? Does it go up? Does it go to the sides? Okay, very well. Okay. From a level, from a 0 to 10. 10 is the pain level. Okay. Okay. So I'm gonna ask you some questions about her past history. Okay. Has she ever been hospitalized?
No.
Has she ever been in a like car accident
No.
or had any injuries? No? Okay.
No allergies and no meds.
Do you know if she up to date with all her vaccinations,
Yes.
including COVID and the flu?
Yes.
Okay. I'm going to step out for a few minutes. I'm going to give my report of my findings to my nurse practitioner, and she will come in shortly, okay? Hi, Mrs. Nurse Practitioner. So I have the report of my findings. My patient's name is Amaya Lopez, and she is experiencing difficulty breathing. I did check her oxygen levels, and they were at 89. So I immediately started oxygen, put it on her, and I started, she was laying down at the moment when I walked in the room, and I told her to please sit up to see if that would help. Apparently she nodded that yes, it did help. Okay, and I did inform her and her sister that I would come out and give the findings to you, so we can take the next step.
Alright. So did she have any kind of history of asthma or respiratory problems?
You know, no, but I think as of 3 days ago, she was having some type of difficulty. I wouldn't know to tell you for sure because they really didn't state that, but I know for a fact that something was going on with the breathing, and she was given albuterol treatment, but it did not work.
It didn't. Okay.
It did not work, and the reason why she came in is because she was working out at the gym.
Alright. So I'll go in and take a look at her, maybe get some lung sounds to see if she's having wheezing, because that's typical with asthma.
Okay.
And if need be, we'll also contact respiratory to come and look at her and possibly prescribe something a little bit stronger if it is asthma.
Okay. Very good.
Hello, Ms. Lopez. My name is Haley. I'm the nurse practitioner. I just reviewed the findings that my nurse found, and some stuff did come back a little abnormal. I'm just gonna double check those vital signs to see what I find, okay? I'm gonna go ahead and listen to your lungs real quick, okay? Just take deep breaths for me. I'm gonna listen through the front. Just deep breaths, okay? Okay, and I'm just gonna double check your oxygen levels, okay? So I can confirm I do hear wheezes in your lungs, and that's pretty typical with asthma. And my nurse told me that you've never been diagnosed with asthma, is that correct?
That's
Okay. So you also mentioned she had an albuterol treatment and that did nothing.
yeah.
So we might have to try something a little bit stronger. I'm gonna have my respiratory team come in and give you a stronger treatment, see if that helps. We're able to get you a little more stable. But I am gonna, if it does help, I'm gonna go ahead and put in a prescription for some asthma medication. And they'll explain it more in detail. But hopefully it helps, right? I'm gonna go and get the respiratory team now.
Thank you so much.
Hi, Ms. Lopez, I'm back. After reviewing your symptoms and everything that's going on, I decided to write a prescription for a corticosteroid inhaler. It's basically to treat asthma. This is a prescription for it. You can take it to your local pharmacy and they'll be able to give it to you. I did go ahead and administer the first treatment right now to help with your symptoms. And I brought respiratory along, and they're going to tell you everything you need to know about the medication. All right?
Okay, so the steroid they gave you is to help with the inflammation of your airway. Okay, so it's very important for you to take it every day. You're gonna be taking it twice a day. And then also I need for you to watch out for the triggers. Whatever is triggering your asthma, you need to, like for example, if you have allergies, you need to address that. And then also if you're gonna exercise or whatever, just make sure you also use your albuterol, okay, on top of that, because there's two different. There's the short acting and then the long acting. Okay, so here is your instructions. And if you have any questions, please call us back.
All right, bite again. Yes. And don't forget your